This video is a part of the public education program of Dr. Batham Pharma Consultants, being produced in the interest of public health. Now we are finding increasing number of cases of dengue appearing once again when the monsoon is still on in the country, and it is quite likely that these cases will go up in number, and therefore it becomes mandatory for all of us to protect ourselves from dengue fever. Dengue fever, I am pronouncing wrongly. This is indeed dengue. So this is called dengue or dengue fever. And the severe form of the disease is called dengue hemorrhagic fever. So that is what people many times do not understand and call it wrongly as dengue fever. Dengue fever is caused by the bite of a mosquito called Aedes aegypti, which is active during the daytime, and therefore the bites occur in the sunlight, and therefore it becomes imperative for us to protect ourselves from mosquito bites in the daytime to prevent dengue. And for this one should wear some mosquito repellent on the clothes, and also put on clothes that are able to cover the body fully. बात रख दे, अभी बोलेगी तक पता रिकॉर्ड कर रहा हूँ मैं, हैं तेरे को बोलना भी अभी बढ़िया तो सुनेगी ये जाएगी सुन ले, then you listen to me carefully. The dengue fever is characterized by the onset of a flu-like illness which progresses to development of high-grade fever associated with severe pain behind the eyes, headache, body ache, joint pains, further progressing into a severe illness which takes the patient down to the bed. Furthermore, there are symptoms like rashes, and there may be signs of bleeding under the skin, which may appear in the form of contusions as we get after a blunt injury, or there may be small dots indicating bleeding under the skin. So one of the major complications of dengue fever is bleeding, increased tendency to bleed, and this occurs because of the drop in the number of the cells in the blood that are supposed to prevent excessive bleeding, and these cells are called platelets. So if you recall, there are three types of blood cells: red blood cells, white blood cells, and platelets are what we call thrombocytes. So the thrombocyte count in the blood of a patient with dengue goes down, and that increases its chances of bleeding either externally or internally, and excessive internal bleeding in dengue hemorrhagic fever leads to death many times, unfortunately. And therefore this video is trying to give you some information about the management of dengue fever. Dengue fever, being a viral illness, unfortunately has no antiviral drug to fight against this disease. However, the disease can be pretty well managed with conservative measures like control of the fever and correction of dehydration which occurs during the illness. क्यों परेशान करते हैं यार? Dehydration can be corrected by oral administration of plenty of fluids and electrolytes, and if that doesn't serve the purpose, one can even take resort to the intravenous administration of normal saline and other intravenous infusion solutions. My objective behind producing this video is to tell you that although there is no specific antiviral drug available today, but certain Indian herbal medicines, particularly the extract of the papaya tree leaves, has been found to increase the thrombocyte or platelet count in the blood by stimulation of the bone marrow. And this thing is very helpful in bringing up platelet counts and thus restoring the blood clotting functions of the thrombocytes, through which they stop excessive bleeding. So there are a number of pharmaceutical forms of the extracts of papaya leaves available in the market, and these can be bought from the medicine shop either directly, or you can even order from Amazon and other e-pharmacies. Okay. If one can take care of the lowered thrombocyte count and prevent thereby excessive bleeding, one can prevent the deaths and thus save lives. So this video simply tells you that it's a manageable disease, though viral and not having any specific treatment to kill the viruses, but we can symptomatically manage the condition and save the lives of patients through correction of fever, control of pain, and correction of the fluid and electrolyte balance. And to support the bone marrow function, you have papaya leaf extracts, and the tablets of papaya leaf extract are being marketed by Himalaya Drug Company under the name Platenza. Platenza perhaps is derived from platelets. So to stimulate the platelets, you can buy the Platenza tablets. Another company, Micro Labs, has a brand called Caripel, and Caripel name perhaps is derived from the botanical name of the papaya tree, which is called Carica papaya, and Pel stands for the tablet. So the Caripel is the brand of the Micro Lab, which is available in the market. And take these medicines under the directions of a qualified doctor who is treating you. Do not try to treat yourself. Always be under the care of a qualified medical practitioner. I am not suggesting any treatment whatsoever through this video. You have to be under the care of your doctor. One thing I wanted to add, that platelet function, the thrombocyte function, can be monitored during treatment. And there is a special test through which one can measure the fraction of the immature platelets. So immature platelet fraction can be measured, and if it is found to be increasing, that means the bone marrow reparation is progressing. So in platelet fraction, immature platelet fraction of more than 6.1 is considered to be high. But if when it goes down, so after having reached the peak, if it starts going down, it's a good sign and indicates that the bone marrow function is recovering, and within 24 to 48 hours the patient's platelet count will come up, and that's a good news for everyone. So we got two things: we can monitor the dropping platelet levels or the improvement of the platelet count following treatment, as well as we can institute treatment with papaya leaf extract to support bone marrow function and restore thrombocyte count. Thank you very much indeed. So this is the only message I wanted to give you on this day.